Hi, this is Dr. Mike Jurgowitz, functional medicine practitioner, and I wanted to spend a few moments to explain how functional medicine can help individuals that have hypothyroidism. Many people are not aware that about 90% of individuals that have hypothyroidism actually have an autoimmune issue and not a thyroid issue, and which is called Hashimoto's. And in the traditional medicine model, individuals are often getting very limited lab testing done with maybe a TSH, possibly a free T4, but they're really not looking at the thyroid antibodies. And the reason is because it doesn't change their treatment. So whether it's a primary hypothyroidism or an autoimmune thyroid, the treatment's still going to be the same when the TSH is high. So what's important is whether someone is just being screened for thyroid dysfunction based upon their symptoms or they already have been diagnosed with hypothyroidism, it's important to really test the thyroid antibodies that are associated with Hashimoto's thyroiditis. And what happens is these autoantibodies are made by a part of your immune system that is tagging a protein or enzyme or tissue for future destruction. And what happens is it takes years before there's enough destruction of, say, in this case, the thyroid, before you're going to see an increase in the TSH level. So many times in traditional medicine, if your thyroid antibodies are tested and they're abnormal, you're going to be told that you don't have hypothyroidism, but you have antibodies for someone that has hypothyroidism, because essentially it's a wait and see game. And we know from the literature that there's a 97% chance in the next 7 to 10 years, if your environment stays the same, there's going to be enough destruction, then your TSH is going to increase. So what we do from a functional medicine perspective is we really look at a full comprehensive assessment of not only thyroid lab testing, but the other things that contribute to autoimmunity, such as different nutrient insufficiencies, could be things associated with heavy metals, food sensitivities, intestinal barrier dysfunction. And we really look at a lot of objective data that tells us where your physiology is not functioning normally, and we can really address that underlying immune dysfunction. So you don't really cure the autoimmune disease, but you can kind of turn that dimmer switch down so much that you can prevent that progression, and keep things in check. But in the traditional medicine model, these individuals are not told that they can change the trajectory of their autoimmune issue with diet, lifestyle, nutritional therapeutics.